Well, hello and welcome everyone. It's an honor to be with you today during the Women Leaders Forum for an important discussion on the place of women in innovation related to COVID-19 at this year's Galien Africa Forum. My name is Professor Senait FISSEHA. I'm a reproductive endocrinologist by training and serve as the Chief Advisor to the Director General of the World Health Organization. I also serve as the Director of Global Programs at the Buffett Foundation. I'm thrilled to co-chair the session along with my esteemed colleague, Professor Serigne GUEYE, who is President of the Institute for Training and Research in Urology and Family Health at the IFRU in Senegal. Like many emergencies, COVID-19 has played out along gendered lines and has revealed the great weaknesses in our healthcare system. We know it has been a very difficult year for so many, but in crisis, girls and women are always most at risk. We have seen the majority of frontline healthcare workers and those providing unpaid care at home are most often women. We also have seen that sexual and reproductive healthcare services are sidelined. We've seen an increase in gender-based violence, unintended pregnancy, and early marriage. As we think about our COVID-19 response and recovery and how to prevent a pandemic of this magnitude from happening again, it's really clear that we must center the voices and needs of women, especially tapping into their expertise as we innovate solutions to address the crisis. Already in Africa, leading the way in innovation solution to this pandemic, and many of our panelists have had a front row seat in some of these developments. You know, I am in Rwanda, for example. Here, the government has enlisted robots to provide mass temperature checks and keep medical information for COVID-19 patients through UNDP partnership. In Uganda, ride-hailing app Safe Boda is delivering contraception right to people doors in lockdown through a new partnership. And early this year, 47 African member states in the WHO Afro region adopted a strategy for scaling up health innovation across the continent. This is good news and shows the region's commitment to tech and innovation. We must ensure women are involved in these conversations and decision, from product design to final delivery. For me and many of you that have tuned in today, this is the first and foremost matter of equity and justice. I'm looking forward to hearing more from our speakers today on this topic. First, we'll hear from each speaker individually before moving into a moderated discussion. Each speaker today will have 10 minutes to present. Then Professor GUEYE will moderate a large discussion for us. So without further ado, let us now turn into our speakers. First, we have Ms. Alexandra PALT, the president of Laureate Foundation in France. Next, we will welcome Fatou Binetou SARR, a teacher and a researcher and a laureate of the Macky SALL Grand Prize for Innovation in Senegal. And last but not least, Ms. PUNUNGWE, an expert in leadership development and social impact analyst based in Zimbabwe. Thank you all for being here with us today. And Ms. PALT, I'll turn to you first.
Thank you very much for this introduction and for giving me the floor immediately. So I represent the L'Oréal Foundation. I'm leading at the L'Oréal Foundation, among other things, the important program that you might know, which is for women in science. And I think that relates very strongly to what you just said. So for Women in Science is a program that supports women scientists for the last 20 years. At the beginning, we started to support high-level women scientists, one from each continent. The idea is that what you, to go a little bit further in what you just developed. Of course, women scientific excellence exists. Unfortunately, is very invisible. It is part of, we have seen it during COVID, at least in Europe, all the experts that had a floor at television in the scientific committees were mostly men. Women were not at the table. We have seen that more than 80% of the studies on COVID have been done by men. So we see that in general, there is in an unequal society, crisis and emergency further strengthens inequality. And that is also what we have seen during COVID. So at the beginning of our action, we wanted to make scientific women visible, excellent, scientific excellence, female scientific excellence, make it visible. We also support, of course, financially. And over the years, we have decided that it's not sufficient to give just 5 prizes to extraordinary women scientists. We developed regional and local and national programs to support younger women scientists, especially at the at the level of the thesis or the postdoc. So now every year we support 300 young scientists, and I'm just becoming aware that I'm speaking in English because you spoke in English, and that perhaps I should switch to French because we have a lot more French-speaking listeners probably. Is there any preference for the language?
Apologies to mislead you. I think there are a
lot. No, I don't know. Is there any preference for the language? Because is it better in French?
I would think so. I think we have a larger audience.
Ok. So, excusez-moi, j'ai commencé. Yeah. Excusez-moi, j'ai commencé en anglais.
Excuse me, as I was saying, I started in French because the chair started in English, that's why. So now I'll continue in French. So beyond these 5 prizes that we give to very accomplished women scientists, for the past years we have had regional and national program where we support PhD and postdoc holders. We financially support them, of course, but at the same time, we give them more visibility, and this is very important for them. The fact that they are often seen invisible, they are not invited to the decision-making table, and this has consequences. And these consequences are not only on chances, equality, but also on quality of research. You know, including the perspective of most of half of the world population is very dangerous. We've seen the consequences in medical research. You all know better than I the consequences on cardiovascular diseases, for example, that has been the result of the absence of women and their perspective in medical research. But at the same time, we have the same subject with artificial intelligence, for example. We know that algorithm, all of that reproduce sexist and racist bias, and this is a danger if we do not have a better representation of women scientists. And what we do with our foundation is that on the one hand we award women scientists, but we also make them more visible with communication campaign. Last year we were in Senegal. We gave awards to young African PhD holders and postdoc, and this has been accompanied with a huge strategy of making them more visible. We also train them to have complementary skills that can be useful in their professional career. On top of that, we carry out studies and it's, for example, what we've seen in Europe when it comes to COVID-19. It's a study that's been carried out in Europe, and I think it's interesting because it shows how gender inequality are increasing within a crisis context. 80% of scientific women in our network said that they were more negatively affected by the consequences of the pandemic in their professional career, quite simply because the scientific women would take care of the household more than men, children and so on. 72% said that they had to reduce their scientific production because they were in lockdown. They said that institutions haven't been assisting them to continue working on their research. And two-thirds hope that this pandemic will make inequalities so obvious that there will be a change in the operation of institutions, and that we'll realize that we need to support women more so that they can keep on producing knowledge and research. As it was well said in the introduction, we see everywhere with other programs of the foundation an increase of gender-based violence or conjugal violence as well. And unfortunately, those that fall in poverty, we have a high number of women. And for children that have left school, we know that millions of children will not go back to school. And most of them will be young girls. And therefore, the consequences of COVID, not only health or sanitary consequences, but the long-lasting consequences will be social and economic. In a world where we already have a pre-existing gender inequality, of course, it is harder on women. Thank you.
Thank you, Ms. Paul. That was excellent points that you raised. We are now going to move to our next speaker, Professor Fatou bin. Fatou bin SARR, yeah.
Merci beaucoup. Je commencerai par réitérer.
Thank you very much. I would like to first start by thanking the organization committee and the scientific committee to have associated to such an important event and have given us the opportunity to express ourselves on a project that we've put into place as a team, and has been the laureate of the Macky SALL Fund for Research. Actually, this prize was given to a group of researcher rather. It is true that I have ensured the coordination of the project, but it is a group of researcher, the thematic CAMES research program with teachers and researchers of 19 countries of the CAMES area, and the main goal is to federate skills and energy and the technical platform in our countries, because we know that we are lacking funds for researchers, but gathering researchers together optimizes the use of the technical means that we have at our disposal. This has been put into place in 2012 by CAMES. We have 12 of them. And the health one has set up a project at the onset of the COVID-19 pandemic. He incentivizes us to think about a strategy to support the COVID-19 response. And facing this, we, with new technology, thank God, we were in different countries of Africa, but we were able to meet, in inverted commas, usually virtually. It's really difficult for women because with the confinement, you have to take care of your family and of the children and of the chores, but women were able to lead this project, and we had different actions: awareness raising, training young people on the COVID-19 pandemic and on preventative measures. There was another strategy that was to train young healthcare workers, and finally the African Life Story of COVID-19 project that aimed at having a global vision of the COVID-19 pandemic. When we took a stock of the situation, we realized that there were a lot of publication on Africa. We had lots of data on the disease in Europe and elsewhere, but in Africa, it wasn't really accessible and available. So therefore, we decided that it was important to have reliable data that could be put at the disposal of the international scientific community. And this is why we wanted to really study the pandemic on different aspects, not only about health and the medical aspect, but also socio-economical aspect, environmental aspect linked to the fauna and flora. This is why we put this project in place. We have 6 task group, one that is headed by a woman, the Professor Safia Tungare of Mali, that evaluate the clinical characteristic of the disease by taking into in example Mali and the data that are available there, and then we'll compare the data to Senegal. A second aspect will be studies concerning the socio-cultural aspect that can influence the dynamic of the pandemic in Africa. There, the case study is Benin, then we'll compare it to what is happening elsewhere, of course. Then we have the genome type of the different sources. Then we'll have taken samples everywhere, and then we'll look at pets in Gabon, and we'll try to collect data on all the countries participating to the study and put them to the disposal of all the countries participating. This project was submitted to CAMES when they made a call for project. These projects were submitted, and ours has been able to have a prize with received an award with a funding. Our project was quite ambitious and had to take place in the 19 countries of the CAMES space. Of course, it was an honor for me because in the group there are a lot of women. Yes, there are men as well. And I was given the scientific coordination of the project, and it is in a way of recognizing, acknowledging the skills of women and to put them forward. And it was a great honor for me. What I wanted to say as well is that innovation that can exist in this project is the fact that really we have a multidisciplinary approach and an inclusive approach, because we do not really look only as the sanitary aspect, but also as other aspect, because we know that COVID has affected all our societies, and this can have consequences, negative consequences on our way of living. Many parameters were questioned, and especially in Africa, and our interactions were in a way shaken by COVID-19, and we need to know how the social cultural aspect and environmental aspect were changed by this. So it is a multidisciplinary, multi-sectoral approach and project. Women are well represented. Many group task leaders are women, and many women are part of this project, participate to this project. This is what I wanted to present with an holistic vision that put in synergy social sciences, economic sciences, ICT, that led to a project that we hope will lead to publications, many publications, but especially, especially really reliable data that will allow us to really adapt the strategies that were put into place and to improve resilience, because we know that by thoroughly studying this pandemic, we will be able to put into place systems that will allow us to fight future pandemics or emerging diseases that could come in Africa, appear in Africa. This is what I had to say. Thank you. Thank you for your attention, and thank you for this invitation. I would like to thank all the members of the team that have helped us put this project in place. Thank you very much.
Thank you, Professor Binetou, SARR, for that excellent presentation and the incredible work you're doing, and congratulations also for being a laureate for the Macky Sall Grand Prize. Last but not least, I would like to introduce our next speaker and last speaker, Ms. D. PUNUNGWE, who's an expert in leadership development and social impact analysis from Zimbabwe.
Good afternoon from Malawi, ladies and gentlemen. Thank you for the introduction. It's quite a panel to be a part of and quite exciting questions to address. These unprecedented times, as already noted, have been instrumental in highlighting both the complex issues of development hurdles and the systemic elements that keep almost every sector of development in Africa crawling versus sprinting towards lasting solutions. Whether it's meeting the development agenda goals for job creation, agriculture, education, or indeed the medical solutions rooted within our existing knowledge base and resources, there has always been a notable degree of stagnation when it comes to getting from idea to resourced and widespread solution. During these unprecedented times, very few of us in my line of work were surprised to see those who remained standing. Over the last decade, I've worked with locally led organizations across Africa, developing leadership confidence, strategy, and ownership of their narratives and vision. As a familiar face, I had the opportunity to leverage the strengths I could plainly see in young female and male rising stars from West to Sub-Saharan Africa. Often these innovators are thrust to the head of their communities, and in a lot of cases, simply because no one else was there. Strengthening the social impact systems of this profile of innovators, it takes time and patience, local context, and of course, tailored resources from funding all the way to psychosocial support. I say all this because the reality of COVID-19 and its effect on the communities these organizations directly serve have further heightened the truths about local innovators, which we previously have been eager to paint as unicorn-like resilience. One of the lessons I've been humbled by over the years has been the idea that in Africa, even the poorest of the poor can never say they have nothing as long as they belong somewhere. In March, as COVID fears rose, borders closed around this landlocked Malawi, and our key service providers in health, food security, education, you name it, everything. They went back to where they would naturally feel safest. Unfortunately, without leaving behind the prepackaged solutions, we'd become accustomed to them being able to most capably deliver. This vacuum meant 17 million plus ordinary Malawians without masks, without regular access to clean water, let alone soap. 17 million plus Malawians uneconomically empowered, underinformed, and hardly recovered from the previous season's climate changes and political mood. March 2020 separated the vulnerable from the remarkable. A looming re-election, an invisible disease, funding cuts, hospital and clinic closures, a landlocked country without assured resource to import what they need, with just, in fact, 2 functional ventilators to serve an entire growing population. fear, confusion, disbelief,
We're having a little bit of the connection issue. So we'll give our speaker a chance to see if she can maybe reconnect. We cannot hear you. Ms. PUNUNGWE, can you hear us? We cannot hear you.
I think she's on actually. She's still
Yeah,
on.
she's on, but I cannot hear her. Maybe taking the video off.
My apologies. I hope
Yeah, the sound quality is quite poor. I see that you're having connection difficulty. So perhaps what we can do is see if Ms. PUNUNGWE can reconnect. She was our speaker.
It might be the best solution because I think Mrs. Platt has to leave us earlier. We can maybe take question for her, and in the meantime, she try to reconnect so we can let.
hello, are you able to hear?
Yes, we are. You're
Hello.
back.
Yes, we are.
Yes, we can hear you.
All right, fantastic. Let's hope it lasts a little bit longer. So I suppose I'll pick up in terms of just the effects that COVID had on the countries around Malawi. We saw a lot of incidents of, naturally people taking advantage of farmer panic sales and forcing down the prices of smallholder farmer produce to maximize their own profits in their own more financially able countries. It was really the perfect storm, the perfect storm for homegrown, socially conscious innovators to rise. And while many of the professional institutions we heavily rely on, I would say everywhere in Africa, left by road and special evacuation arrangements and so on, women that make me really proud to have the same heritage as they do, took what they knew at that time. Wear masks, wash your hands, social distance, ration your food, protect the young and the old. And they walked, they drove, they flew towards the challenge to make sure what they knew was heard widely and adopted as best as rural Malawi could, which is essentially 50 million plus of this population. Consultants like myself scrambled behind them, trying to capture their stories, mobilize additional funding and other supportive resources, aggregating the data they diligently collected on the ground before safety measures even existed, while knowing their own lives and their own teams were potentially in danger. Pay cuts were followed by the lack of funding, and even those who were let go in many instances refused to let go because they knew the need in their communities wouldn't miraculously subside. We saw first response healthcare and food security initiatives grow inch by inch and were strengthened immensely by the 4th month of COVID-19's presence here in Malawi. Right or wrong, there was no pause, just action, built on the strength of their drive. And even though the funding did not come or filter down enough to the women who stood up to COVID-19 first, learning and mitigating quickly what would likely escalate and devastate if there wasn't their support present. And now, sadly, here we are today. We have even less food security, even less climate resilience, an economic downturn that is correlating alarmingly with the rise in GBV against women, girls, and boys, including an all-time spike in child marriage. And these occurrences and harmful cultural practices have been magnified by a combination of COVID, underlying pressures, and psychosocial gaps that we had just not been addressing enough through these same local voices. So despite or perhaps because of all these factors, one of COVID-19's most uttered effects for me on women's leadership, voices have been amplified irreversibly and unashamedly. It's restored women's ownership of change-making narratives, it's emboldened their response and unified entire communities around what is right and what is needed. The majority of this self-help was made possible because if not them, the question very quickly became, who should we wait for and when will they come? I asked a fearless community health innovator recently, what would have made a key difference to their last mile community responses in the first 3 months of COVID-19? And her answer both surprised and inspired me. She said, essentially, well, Dee, in a way, COVID gave us our agency back. When you couldn't find or afford the right medication, in most cases, you simply could no longer afford any medication. You remembered how drinking guava tree leaves as a child was just as effective. And when no one would fund us because our applications could not meet their requirements, we were motivated to go through every number in our phones to find any local links to others who had either this or that to share, so we could continue to meet people at their point of extremely basic needs. She emphasized that no, things are still not enough, but they've quickly built networks where they can all belong to share the little that they have. And now that the networks are there, she urged me to imagine what they could do, because no matter what happens, they're the ones who are here first, and have nowhere else to find the safety that others were able to get by leaving. The success of African social entrepreneurs and innovators, beyond their ability to deliver programs and solutions, it depends on the nature and the quality of relationships that we build and we nurture with larger ecosystem players like many of you who are listening here today. Women across every single sector, they stayed, they summed up their courage, and they rose to the occasion, leading positive messaging, reassuring the vulnerable, and doing the tiresome job of being the ever brave faces during these unpredictable times. What we all do next can make or break the course of genuine leadership, flourishing and championing sustainable innovations. Spurred on by looming economic disaster in small communities like Malawi and indeed many others globally, women and young social actors are holding onto their seats at the farthest part of the table. And to gain voice, they need to gain more of our favor. Funding and granting mechanisms all must evolve to make more meaningful, unencumbered and unbiased investment. We really have the opportunity now to decide if we want to go back to normal, or if we want genuine development to thrive in the hands of the people who will be locked down where they stand in the face of more COVID-19 effects or another global pandemic of sorts. Thank you very much, and my apologies for the break in connection. Thank you for this opportunity to reflect and appreciate more sides of the COVID-19 story. It's really my hope every life lost and livelihood compromised by this pandemic will not be in vain. And we have a lot of work to do, but there are certainly ready and able women in all your different capacities can meet the challenge. Thank you.
Good. Wonderful.
It is indeed wonderful, and I'm so glad, Dee, you are able to reconnect so that you can, you had the opportunity to share that inspirational message. So, Prof, we're going to turn into the Q&As now. You alluded that Ms. PALT has to depart, so it may make sense to start with her. What do you think?
Oh, yes, I feel that she said she has to leave, I think, in about 30 minutes, isn't it? Madame Platt, vous devez partir. Hein? De toute façon, je pense que nous avons assez.
That you have to go. But I think we've assisted to a good presentation in the framework of this team on innovation during this COVID-19 period. But I think the most important is to see how Africa has been able to face this challenge. At the beginning, the most pessimistic people thought that Africa would just crumble and even disappear with this pandemic. However, Africa has shown exceptional resilience. And if we just talk about Senegal, for example, or if we look at official numbers, we represent maybe 0.01% of the population since the beginning of the pandemic. And to have this 1%, we'll need to get to 160,000 cases, and we don't even have 4,000 cases. All countries were touched,
and
we are getting
they
ready
are
for
already
something
preparing
that
for
may
anything which
happen.
may occur again.
However, I think that
So we've seen
women,
how women,
we need
in my
to
opinion,
prevent
have been able to
anything. And we see that
contribute to
women
resilience.
have really contributed to our resilience. The first...
This Alexandra Pact of the Laureate Foundation. And I think she's also a teacher like Madame Fatou Bensouda. And this year, there's also been the possibility of working with SARR. She is a scientist who is privileged, who is in the milieu of women, and he has a particular interest in the maternal health, and he has worked in surgery all over the African continent, and
Madame, vous l'avez dit au départ en introduction, cette pandémie
problem of surgery. We are still having internet problems. We don't hear all the sentences. Unfortunately, with confinement, girls cannot run away when they want to be sent into marriage. And health structures are not all functional because some of them are reserved only for COVID-19 patients. And unfortunately, this has led to the mortality of women, and this will increase, and there will be other cases of complications. So we're expecting a rise in complications related to pregnancy and birth, and some of these cases will increase. A few weeks ago, we started an outreach. A team in Bissau is already on the ground, and we have to be very careful on the impact of this pandemic on women. Now, I'll go back to the panel now. I think we can start taking questions, if any, especially from Madame PALT, who said this right from the beginning, and then we'll continue with Madame Fatou Bensouda.
PUNUNGWE. I don't know if you have any question on the chat box, or if you do have them.
Sure, let's start out with Ms. PALT. You know, for several years now, the L'Oreal Foundation has been celebrating exceptional women scientists and young researchers at the international level and in Africa. Tell us about some of the most inspiring women you've met and how the pandemic has changed your perspective on their leadership. And also, what role have some of them played in the face of this health and socioeconomic crisis?
Yes, so maintenant je vais répondre en français. Donc, premièrement, merci.
French. First of all, I think that it is interesting. That is what the professor has just said, and what is expected from Africa. Because I think what is very interesting is when we are communicating and relating, we always hear a lot of things about Africa, and that the situation in Africa is catastrophic and things are very serious. And I have been questioned by many journalists to express my views on all of that. And indeed, it was really something to show that these predictions were not correct, and that Africa has the capacity to resist. And as women have an extraordinary role, we all can see that every day we have to fight against these stereotypes.
À notre niveau d'y contribuer en mettant en avant des femmes.
I lost connection.
Ce que je remarque, et ça c'est quelque chose que les femmes scientifiques ont en commun partout dans le monde.
Scientific women are commended all over the world. These are women who contribute to something which is bigger than themselves. So I think this is a field of science, but this is strongly felt by women and amongst women. So women in the science field dedicate their lives to their research, in which way they want to contribute to the development of the world. So it is always a cause, always a subject which is bigger than they themselves. And what is interesting is that in general, these scientists always ask themselves a lot of questions. They're always humble, and they always ask questions, put themselves into question. And amongst women, unfortunately, there are at times too much humility. So in this scientific milieu, they are very humble in addition to their education. And you are required to be very humble, very modest. And this is a dual humility. You are modest and you have to be humble. So they should be encouraged to take their full place in the society. And this is something which is very important. Now, in that framework, I would want to say that there are things which we often find in the African continent than in other parts of the world. But this is something which women all over the world do share. Where there are obstacles which women face very seriously in Africa, it is in taking care of children, healthcare for children, and their house chores. And this is perfect in all parts of the world, and this is very common. We find that pressure. Mother, this is family responsibility, and this is very important. And it is indeed a challenge to the lives of women. So amongst our young talents, our African young talents have indeed included COVID-19 in their research. There are young scientific African women who try to focus on many of these challenges which the African continent is facing, such as climate change, infectious diseases, sustainable agriculture, and food security. And unfortunately, now there are more women who are working in the computer field, etc. But
auxquels fait face le continent. Et cette année, on a bien sûr vu plus de jeunes femmes qui travaillent aussi sur le.
We have lost connection. The interpreter is sorry.
We can hear you.
Okay, thank you very much. Thank you.
Pardon? Sorry.
So reconnected. Continue, madame. You may continue, madame. I can.
Donc du Congo, qui elle à son tour en revanche aussi a alerté sur justement, on voit ce qu'on peut faire quand le monde fait face à une épidémie comme le Covid, N'oublions pas qu'il y a d'autres maladies auxquelles l'Afrique doit faire face, qui concernent par exemple comme le paludisme plus l'Afrique, et on ne met pas les moyens et les efforts.
We did not put sufficient means and sufficient effort.
Les femmes, donc nous on a vu qu'elles prennent en charge cette nouvelle thématique, mais elles gardent également en tête qu'il y a d'autres questions de recherche scientifique, d'autres questions de société, d'autres conséquences dont on ne devrait pas oublier.
Yeah, thank you, Ms. Paul. Thank you, Ms. PALT, for that excellent overview. I'm going to turn into Professor SARR now. Professor SARR, this year you are awarded the Macky SALL Prize for Research by the African and Malagasy Council for Higher Education, CAMES. Your work aims to better understand the dynamics of COVID-19 in the Francophone region of Africa in order to build resilience in the face of emerging diseases. What is the place of innovation and women in this project?
Merci beaucoup de me donner l'opportunité de m'exprimer à nouveau. Je commencerai par saluer la présence de notre maître, le professeur Serigne Maguèye, qui a contribué grandement.
Thank you for allowing me to take the floor, and I would like to commend first the Professor Maguèye, and I understand his advocacy, and especially on COVID-19, but also on the health of women that could be really altered by confinement, but also gender-based violence that would result from it. As I was saying earlier when I was doing my presentation, the project that we had has been awarded the prize of Macky Sall Grand Prize for Innovation of CAMES. CAMES is a sub-regional institution that supports young teachers, researchers, so that they can evolve in their professional career. The research team is being directed by a professor in Gabon, but they decided to give us the scientific coordination of the project. And as I said, our project has been laureate by the Macky Sall Prize for Research. As I said, this is a more holistic approach of the COVID-19 pandemic that wants to evaluate the different aspects, not only the sanitary aspect, but also socio-cultural, demographic, economic. We cannot hear you. Can we hear you? I think there is some interference with your microphone.
Est-ce que vous m'entendez?
Madame Star?
Can you hear me now? Can you hear me? Yes, I hear you. Can you hear me?
We can hear you very well. There may be some challenges
Yes, we
with
can.
translation. So for those who are not speaking, please mute your microphones. But Professor SARR, please continue.
D'accord, merci beaucoup. Donc, je disais que le
Thank you very much. So I was saying that the innovation here is this multi-sectoral, multidisciplinary aspect, because we've added meteorologists.
I'm not hearing her.
Can you hear me now? Hello.
I think we're having translation challenges, so my recommendation is to let Professor SARR speak in French, because the audience can hear her quite well. So, Prof. SARR, please continue. We apologize with some of the challenges that we're having. The translators are having a hard time hearing, but please proceed.
Effectivement. Bien, donc je disais...
So, as I was saying, it is this multidisciplinary approach that puts together different disciplines, but also doctors from different areas.
À étudier les aspects.
All are working to study the different aspects. I'm sorry, I had some issues with the interpreting.
Oui, vous m'entendez?
Can you hear me now? Can you hear me? Yes. So I was saying that it's this multidisciplinary approach that include all different disciplines. Of course, as I said, women are well represented in the team. We have professors from Mali, Gabon, the Côte d'Ivoire that are involved in the studies, but also from Senegal, or where I am a member of the team. Where you also have a Professor Job, that member of the team. The place of women in this project is really interesting, and we hope that we will be able to find a positive result and to the benefit of the whole community. Thank you.
Thank you very much, Professor SARR, and I'm sorry about some of the difficulty we were having with the translation services, but thank you for your insight. Now I want to turn into Dee PUNUNGWE. Dee, thank you for that insightful overview that you gave us, and just highlighting how just the situation had forced us to rise up to the occasion. So how do you see innovation during this pandemic creating new economic and decision-making opportunities for women in Africa that are struggling against patriarchy?
Thank you very much. I love answering this question, simply because, you know, it, in a lot of ways, had everything not gone the way that it went this year, we wouldn't have been forced to look for all this internal strength and, you know, look in the unusual places for the resources that we've always had, you know, meager or not meager, it's still somewhere to start. And I believe we are really just getting started. This idea of network building is such a powerful premise. We won't have the opportunity to change things overnight, but if a critical mass of us are moving in one direction, then we are certainly going to be better off than before. Another thing that I think is really important for us to consider is that innovation has always been taking place, but the voices of women have always been quieter. And in fact, when we look at the whole social impact space, the local voices have always been quieter because, again, you know, our resourcing and our agency, it tends rather to come from abroad. So the minute we all realized we might truly be here alone and have to face whatever is coming, you know, more alone than we've ever known, a lot changed in the minds of particularly young people. And, you know, we've seen all sorts of incredible innovations from recycled and upcycled items that were made into protective gear, from resource sharing and people really digging into getting to know their local economies and trying to figure out that in the instance that we can no longer get something from somewhere else, you know, the very basic is food, and how do we make sure that what we grow is enough for all of us, and how do we start to think about how we safeguard some of that that resource for instances like this. I mean, what we're seeing now is an incredible hike in food prices, because unfortunately when COVID hit, the first reaction was to sell everything you have so that you could have at least the monetary resource. And you know, for the average Malawian who is a rural farmer in rural Malawi with, you know, a heritage of that and probably a future of that for their children to come, it was the only thing that they could think of doing, you know, securing a bit of money, because traditionally that's what you would do to survive. And, you know, fast forward 6-8 months later, we're in a place where that money you safeguarded at that time doesn't have the value that you expected or planned for. So we are seeing this prevalence hunger as a huge knock-on effect for COVID, and coupled with the climate change and the just so many prevailing issues that we're really starting to see, if we don't change our own behaviors, and if the local voices are not championing that and are not creating the cyclic loops for us to hold ourselves accountable as we strive for that, then we won't be able to change the narrative for ourselves. And what I love most about this time is that, in a typical patriarch like Malawi, a patriarchal country like Malawi, we are seeing that men are turning to their wives and saying, this is a very strange time, and unless we have a way to start thinking about how we work together, it's unlikely that we'll be able to change things. And this is why we're starting to see more unified and positive voice against those things that were more traditionally swept under the rug, including child marriage that's tends to be encouraged by some of the patriarchy and families, erring on the side of culture and tradition and carrying on what they already know to be true and normal. And we're seeing this stop in time where everybody's questioning what that really even means, and really reflecting on how you do better and how we can sustain that better, because no resources are promised. So really the space, or rather this time and the space for innovation is for everyone. And we're seeing women's voices be amplified, and there's a lot more narrative around how we support that to continue. But as a person who's had lots of experience in this space, what I'm really looking forward to is, yes, let's all say the right words and the buzzwords and the correct narrative, but let's back that with really, really useful and meaningful and investment that actually has the potential to stick. So, our place is to keep on speaking up, and globally, everyone's place is to take more responsibility about how we receive resources here in Africa, and making sure that it's going in the hands of the people we've seen rise right now, the hands of the people we've seen take the most responsibility and the most risk and make the best kind of decisions. And we all have to just hold on to that accountability and keep questioning ourselves as we move forward. Yeah, I hope I've answered that question for you.
You sure have, Dee. So thank you, Dee PUNUNGWE, for just such an enlightening and building a picture of the interconnectedness of our world, from food security to gender-based violence, and the value of the leadership of women. And I think that focus on ensuring that people who've taken the risk and have risen up are also getting the resources. So thank you very much. Now I think I'll turn it back to my esteemed co-chair, Professor, to lead the remaining discussion for the remaining almost 30 minutes we have. Professor, to you. Professor GUEYE?
I think he's not online.
Yeah, so I see that we may have lost him. That's okay. So what I would like to do is I would like to continue back with the panel of among people who are with us. If there are questions from the audience, you can put it for me in the chat room. Let me just quickly check in the chat room to see if there are any additional questions, but if not, I want to get back to continue with a few more questions. Back to Dee. Dee, you raised the question of what happened with the pandemic. As this pandemic started, what we have relied on historically was on having our global partners flying in, right? Flying in and fixing things for us, giving us the support. But what has happened with this pandemic is because flights were suspended, right? We have now adjusted to a new reality where voices and access to technology and platforms and tables have been democratized. We have seen, as you acknowledged, a new kind of leadership where communities are rising. What do you think we need to do to sustain this new gained voice or for women, especially women and girls, to sit at the table, to demand? How do we sustain that, especially in the backdrop of a society that has not put as much resources to protect the rights of women and girls, their bodily autonomy, early marriage, some of the issues that you've raised, domestic violence. So how do we build back better and sustain the gains, especially around voices for women and girls that we have now seen since the pandemic? So back to you, Dee.
Thank you for that. I think the shortest answer to that is we definitely need to collaborate. I see this a lot with the organizations that I work with, where everybody is doing really, really exciting and rich and well-informed work within their own bubble. So you're in your community, you came out of that community, and you know, in a lot of instances, you are so passionately driven to solve all the problems that you can identify within that community, even without the right resources or the right experience. And you know, unfortunately, because there is really this crabs in a barrel style funding machine that exists globally, you never really open up to the next organization about, you know, your 15, 20, you know, 25 years of work within that space of really getting to know your community. You know, you don't share all the wins, all the hardships. You don't tell the story about how you grew your talent, even with meager resource. And that is such a huge hurdle for us to get over. And unfortunately, it's currently powered by the way funding works. So we need to collaborate, and we also, which is a mental thing at this point, you know, because we are afraid that if what I'm doing and you know, how well I'm doing here in this community is understood and maybe taken away and done in a bigger, more visible way, then you lose some of that traction and support that you've had over the years. And sadly, we've seen that that is true, but not true in every instance. But it does dent the confidence of innovators to continue their work and to really put it on display in a way that we can all learn quickly, and we can all start to aggregate and connect all these responses in more meaningful ways. And on the other hand, if we look at the other side of the issue, which is how funding is designed, it's a very natural instinct for someone to feel as though you want to put your investment or your grant funding or whatever it is in a place where it will be secure and used well, and you know, psychologically familiarity will rule the day in terms of how you maneuver that. And because of this time, we are seeing a shift in people's perspectives. We are seeing a more deliberate openness. We're seeing people look at African talent and African resources in a different way, because when they couldn't fly here, they would have to sort of work with whomever is on the ground, and that does take more investment, and that does mean that you have to sort of remodel how you've worked before and how you've thought about things before. And I'm personally excited about these times because we're seeing lots of positive steps forward. We're seeing funders who wouldn't look at someone who works with, you know, maybe 500 to 1,000 people and needs $10,000 to run whatever that program is, but you know, it's an intrinsic and pivotal part of that community. You know, they wouldn't look at a funder like that because they wouldn't look at an innovator like that, because you know, the workload would be too much to chase around what they would see as a very small amount of funding, versus being able to, you know, just invest $1 million in one go. So now we're seeing that if funders can think about aggregating their resources differently and working with people on the ground differently, there is an opportunity for us here in Africa to collaborate and organize ourselves and build these networks. And, you know, because we know the context and all the local nuancing, we know how to best finance A all the way to Z in a way that we know how to use the resources so that they last and continue to be reinvested within the space that we are. So I can see that we are changing the game in a lot of ways. And if you think about the history of AIDS in Africa, this is such a long and tiresome history in many ways. But this is the moment to show that there is so much capability here. And with that initial investment in just collaborating and aggregating the resources and, you know, speaking with one voice in as many platforms and places as possible, then, you know, there's ways for us to start to really accountably receive funding and put it into the projects and programs and lasting social enterprises that will, you know, grow in exponential ways. You know, one of the largest issues we have with the whole development complex is that we struggle to help ourselves because there aren't as many job opportunities, and that turning towards enterprise that we're also seeing happening at this time is going to wind up hopefully also answering those sorts of questions. If you really don't stop me, I can continue going on and on. So I think I should stop myself at this point.
Well, thank you very much, Dee. So Professor GUEYE, to you to lead the remaining discussion and close us. We have about less than 15 minutes. Thank you, Professor.
Thank you very much. Merci beaucoup. Je pense qu'on a non seulement assisté à de très belles présentations de nos différentes.
We have assisted to very interesting presentation from our different panel members. I would like to remind the fact that this is a group of women, but also the questions that were asked. I think that the theme is what is the place of women in innovation, and especially what are the innovative solutions that women should implement, not only for the COVID-19 response, but also for resilience. I don't know if we have any questions. I'm not sure. Are there any questions in the chat box? I haven't seen any question, but I wanted to ask a very important question. It is not only the sanitary aspect, of course, we also have education in it. And to me, education may be linked to the closing of schools in many countries. Many governments have decided to close schools, and maybe the change in the training method. I think that in our countries, we put children that didn't have any exams at the end of the year, we let them stay at home. And the innovation with education so that young girls still retain the same chances, and especially during COVID-19. I am really sorry, Professor, I did not hear your whole question. There were some cuts in what you were saying. Yes, I was talking about young girls losing some, I was talking about education in general, and what did this COVID period teach us so that there will be no problem for children to go back to school, and especially young girls. It is a very interesting question, Professor. Thank you very much, because we are ourselves really interested in the ways to really help women and young girls and women to stay in education, because we know it, even without pandemic, it is very difficult for young girls to have access to schools. For some, because of social pressure, sometimes they stay at home for household chores, and if they have access to school, it is very difficult for them to stay. Social pressure that Mrs. D has mentioned earlier are so strong that it is difficult for them to stay in school and to follow up with their school project, their life project in general. And indeed, the COVID-19 pandemic has, in a way, really exacerbate this existing situation. When it comes to primary and secondary school, it is true that strategies were implemented in order to ensure that children still have online classes. As a mother myself, I experimented this, but it wasn't easy for children. For universities, it's true that the COVID-19 pandemic has changed, has shifted our paradigm, because before that, it is true that we would insist in-person classes to all be present in the same lecture theater, but we realized that actually we could change our way of teaching and of learning, and this pandemic has allowed us to really dive in digital teaching, because myself, I am a teacher at the University of Thiès. And when we had to finish the program despite school being closed, we we had to post our platform, our teaching in platforms, in online platforms. And we realized that it wasn't that difficult and unavailable, and it could actually be very useful for teachers and students. And even if in-person classes have resumed now, we have still we are still using this online mode. Some classes are done online and others in person, and I believe that it could help to maintain women and young girls at school, because we know that everywhere they are, if they have a good internet connection and the tools to get online, it would be possible to bring knowledge to them and to help them accomplish their project. Thank you very much. Thank you. I don't think it's, I think it will also allow women, teachers, scientists to better be to better juggle their family obligations and their career. And yesterday, the speech of the president saying that he wants to connect all public university in Senegal, and I believe that this will help us to save time and to be more efficient. There is a hand with the participant. I think Mr. Hubert Nyanvi that would have a question. If we could allow him to ask his question. There is one hand. Could we give him the floor? Hubert Nyanvi.
Maybe Mr. Nyanvi to ask a question. I don't see any question in the chat box. And Samantha raised hand. On a une deuxième main qui est levée.
There is a second hand being raised, which is Bintuja. I don't know if it's possible to give them the floor. If technical assistants can help us and give the floor to them, technical support, please give them the floor in the last minutes of this session so that we can give them the floor.
Apparemment, no.
It would seem that it is not working.
They can have the floor. Hubert Nyanvi. Si c'est pas ça, je pense qu'on pourrait peut-être revenir.
If it's not working, maybe we can come back to the importance of this session.
And then I'm going to let Senait to say the final words. I'm going to try to do it in French. Je pense que cette session a été essentiellement
I think that this session was on the place of women in innovation, the innovation in COVID-19. I think that women have had a very important role, as it has been shown, and I think that they are at the forefront, at the back, at the middle, everywhere. COVID-19 has brought many changes in their living conditions and has put together people that wouldn't see each other all the time. And I think that during confinement, lockdown, that family would get together more. People that would just see each other at the door would find themselves confined in spaces, and this has led in many countries to an increase of GBV. Once again, we need to remember that GBV are gender-based violence, not only violence towards women, but also violence toward men that we do not talk enough. Regardless, gender-based violence, but also the fact that women at home, young girls do not go back to or do not go to school, means that there are more and more child marriages. People that live with this has led as well to teenage pregnancies, and the fact that people did not have enough access to health services such as family planning, as well as reproductive health. This lead to an increase of population, and but also of maternal mortality. And I think that on this, women have needs to be more innovative so that we can limit the consequences and impacts, socio-economic impacts of this COVID-19 pandemic on the society. As we've said it, Africa has shown exceptional resilience, what was expected, the doomsday prediction of the WHO as well. I'm sorry to say that, but they said that Africa would be really affected, and we've seen that Africa is one of the part of the world that is the less affected. In our societies, with our decision makers and this resilience mentality that we have, African people weren't able to take planes and leave the countries. And up until now, certain parts of the world are not open to us because of restriction, which means that we need to focus on education, for example, so that our students can still study well in Africa, stay in Africa, and that the population in Africa are in a good condition. And this is the main goal of the investment fund of the president, so that Senegal can have health infrastructures with competent professionals that can do their work in the best of conditions, so that the populations can receive the best care, so that we do not have to travel elsewhere to go to the hospitals where we find sometimes doctors that were actually trained in Senegal. I think that we need to focus on that so that Africa can be even more resilient, and that our countries can really become more independent when it comes to education and health, that are basic services. We should not also forget the fact that I always say that a pandemic, the management of a pandemic is not medical, it's sanitary. When you have to deal with a pandemic, you have to put yourself in the shoes of an arm or a soldier. It's not just with doctors, it's a global problem. And to be able to mitigate the impacts, we need to talk about health, environment, hygiene, but also funding. That is not the most important, because we have money in Africa. We can mobilize money in Africa. We just need to have better partnership. I would like to thank the Minister Eva Marie Kosek that is here on our session, and she knows how much we appreciate her. When I was in my first year of medical school, I had the chance of doing an internship in her department, and I think that we really try to give back to her everything that she's given us. I'm really happy that this forum has taken place despite the challenges of the COVID-19 pandemic, and I'm really happy, and I would like to give the floor back to Senait. So this is the end of my intervention on this forum. Senait, you have the floor. Thank you.
Back to you to say the last word.
Merci beaucoup, Professor GUEYE. This was excellent. I also would like to acknowledge Awa Marie Kolsek, Professor Kolsek has been a trailblazer and an example of what women leadership can do in this continent. So I'm really, really grateful for not only all the work you do for the country, for Senegal, for the continent and in the world, but also making room to shine light even before the pandemic about the role of women in society and also particularly in advancing science and technology. I am glad and very grateful for all our participants who did a fantastic job shining light. And I want to leave us all with the 5 asks. As you know, the Women in Global Health movement around the world has been demanding a gender-responsive response to the pandemic, particularly when it comes to what they call global health security or emergency response. So the 5 asks are to include women in global health emergency preparedness or global health security decision-making structures and public discourse. Now, given the fact that 70% of frontline health workers are women, but they are not represented in leadership is a problem. You know, we see them being 70% at the front line, but less than 20% when it comes to decision-making. Providing health workers, most of whom are women, with safe and decent working conditions, including PPEs. Recognizing the value of women's unpaid care work by including it in the formal labor market and by redistributing unpaid family care equally. And I was very pleased to hear Professor GUEYE addressing the role of sexual and reproductive health, not only preventing gender-based violence, early marriage, but also allowing women to have bodily autonomy and having families when and if they desire. Adopting a gender-responsive approach to health security data collection, ensuring that the data we gather is sex and gender disaggregated. And analysis and response management include SRHR, GBV, and girls and women's health need. And finally, as Dee clearly outlined, fund women's movements to unleash the capacity and to address the critical gender gap and elevate women, and not just in science and technology, but women leadership across the world. As we have seen firsthand, what happens when women like, you know, Awa Kolsek, women like the former president of Liberia, Sirleaf, who's leading the WHO's independent panel review, or African women like Ngozi, who are leading the vaccine COVAX envoy, and as well as so many other women in the continent, and men and boys. So thank you so much for a very insightful and meaningful session. Very much grateful for the Galien Society and the organizers, including Professor Awa Kolsek. And we look forward to staying in touch with you, and more importantly, hopefully seeing you in person if we have equitable distribution of vaccines, that we'll see you back in Dakar in person next year. Thank you again, and this is the conclusion of our session. Have a wonderful day.
Thank you.
Bye-bye. Thank you. Thank you, everyone. Have a great, bye-bye. Bye.